It's our immense pleasure to welcome Dr. Vasudevan Namboothiri on the stage. Sir will be discussing about the topic Technology and Ayurveda Experiences in Clinical Application of Rasayana, and this session will be chaired by Dr. Chandramouli Ishwanan.
Shadanjeeva Shardu Varthamana, Shadam Hemandan, Shadam Vasandan, Shadam Indragni, Savita Brihaspati, Shata Aisha Havishayamam Pinardu. Actually, you see, I am very thankful to the organizers of this seminar for inviting me. Dirghamayu Smritim Metham, Arogyam Taranam Vaya, Prabha Varna Swara Udaryam, Dehi Indriya Belodayam, many qualities are attributed to Rasayana. You see, preventive qualities are there, curative activities there, palliative care, whatever we explain now, in modern terminology, everything comes under the heading Rasayana. Next. You see, actually all the chronic diseases, including cancer, can be defined as desperations experienced at the cellular level. If some mental trauma is occurring some many years back, that is suppressed in the body and it may exhibit as a disease like a cancer or arthritis or any autoimmune problems, because all the chronic diseases can be defined as desperations experienced at the cellular level. Next. See, this is the Samanya Samprapti which I need not explain, but one sloga you have to study. Dushayatva resam dosha viguna hridayakata, that is related to hridroga, wherever this dosha dushti it leads to dhatu dushti, and dosha dushya samurchana is prolonged for a very long period, definitely dhatu vikriti occurs. Dhatu vikriti leads to many chronic diseases. In all the chronic diseases, dhatu vikriti will be there, which can be corrected with Rasayana alone. Because Shodhana Chikitsa, I always tell that Shodhana Chikitsa acts at the level of doshas. But Rasayana Chikitsa acts at the level of dhatus. Next. You see, Shodhana Chikitsa against Rasayana Chikitsa. Here the most important point is that it strengthens the dhatus, moreover, prevents the instinct of recurrence, instinct of disease, which means that, this Roga Vasana means, even after curing the disease, especially many chronic diseases like arthritis, psoriasis, vulgaris, many diseases, even after curing with the more Shodhana Chikitsa, after 6 months or 1 year, the recurrence is in, which means that, there is a Roga Vasana is there, because Dhatu Vikriti is there, which cannot be corrected with the Shodhana Chikitsa. At that time, Rasayana is the regime of choice, because Rasayana drugs acts at the level of dhadus by correcting its structural deformity. Next. You see, this is the mechanism of action of Shodhana Chikitsa. Shodhana Chikitsa creates some level of Agnimadhya which can be corrected with Payadikrama. Then it leads to Kayagdipti, which leads to Tatogdipti. On the other hand, Shodhana Chikitsa produces some level of Sroto Nirmalata, which leads to Dhatu Shuddhi. Dhatu Shuddhi, along with the Tatogdipti, produces a suitable environment inside the body for the application of Rasayana. Next. See, Rasayana are not having any common dasa or virya, because Yalkinjil Madhuram Methyam Brahmanam Veravarthanam Manaso Harshanam Mecha Tal Sarvam Vrishyam Chudi. All the Vrishya Ushadas are having some common properties, but Rasayana Ushadas are not having any common property, because Hilishana is a Rasayana Drivya, Amalik is also a Rasayana Drivya. See, the difference between two Dravyas, hence, but all the drugs produces some level of Sroto Saushtava, and because that is very essential for this conveying the nutrients to each and every cells in the body. Next. You see, Shodhana therapy acts at the level of doshas, Rasayana drugs are still deeper at the level of dhadus. That is why Labhopayo hi shastanam rasadinam dhadunam Rasadinam Rasayanam. As aging is a chronic, degenerative and deep-seated problem, Rasayana Chikitsa is the regime of choice. Next. this is a clinical study conducted in Trivandrum, Ayurveda College, Pallataka Kshira in oral carcinoma. Because the patient already had chemotherapy, radiation, everything, But you see, ankylosing, dysphagia, dysarthria, severe pain, everything was there, which we were able to treat with Pallataka Kshira. Five number of Pallataka was, first of all, after Shuddhi, it is crushed and Kshira Kvasa was made and that was given to the patient daily. Next. See, excellent result in increasing body weight. You see, in every cancer patient, ESR will be high and hemoglobin will be low. In arthritic patients also, in every chronic disease, this is a common pattern. But after the Pallataka Kshira, increase in hemoglobin was seen and decrease in ESR also, which means that ESR, it is only a inflammatory marker. Next. You see, this is a case of psoriasis vulgaris, where we were able to do. Next, Tuvaraka Rasayana. In one group of cases, we did Rasayana treated with Shodhana Chikitsa alone. This Snehavana was done with Arikatha Mahadikta, Vamana was done, then again Snehavana, then Virejana. Then in another case, after this Shodhana Chikitsa, Tuvaraka Rasayana was given. Tuvaraka Rasayana, which is a very small quantity. Tuvaraka Taila is medicated with Khadira, Tadeva Khadirakvathe Turgune Sathu Sathidam, because Kushteshu Sevya Khadiras is Sara. Khadira is the Agri Aushadha of Kushta. Hence, Tuvaraka Taila is medicated with Khadira and that was given to the patient only. Panjahani Pibe Tailam, it is advocated or advised only for 5 days because it is highly nephrotoxic and highly hepatotoxic if continued for more than 5 days. It was given with milk, 2 or 3 times of Vamana will occur and 4 or 5 times of Virejana will occur for 5 days. Because Panjahani Pibe Tailam, only 5 days it was given. Actually, you see, next. Following the Shodhana Chikitsa, only clinical improvement was seen. But histological changes was only seen in Tuvaraka Rasayana. Next. You see, this is keratinizing cell, the black part, the black part. Even after Shodhana Chikitsa, it is again seen in the biopsy of the skin. But after 3 months of Rasayana Chikitsa, you see, the color of the skin, the color of the biopsy is 100% correct, which means that, Rasayana Chikitsa is having that much of depth action. That is why it is, if some disease is cured with Rasayana, recurrence, we can forget about that disease. It won't recur. Hence, in chronic deep-seated diseases, definitely it is one of the regime of choice. Next. This is a case of pulmonary mucormycosis, which means that, fungal infection of lungs, for which modern medicine is not having any remedy. Actually, the patient is tired, he is severe dyspnea is there, cough is there, and he was admitted, and Indugandam, Shwasanandam, Dashamaragadatre, all the shamanic drugs were given, along with the Panchakola Yavagu for his Agni, Pajana, as in Agni Vartaka. Then, next. Snehapana with Indaganda Krita was done, small doses, because patient is very weak. Then Murdu Virechana with Avibhati Churna and Varthamana Vipali Rasayana. Kramavritya Deshahani Desha Vaipiligam Naram, Varthayel Paisasartham Tadhaiva Avanayel Puna. Desha Vipali means, 10 Tipali. But Tipali may differ in size. One Tipali may not be having the size of other Tipali. Hence we standardized the dose. 3 grams of Tipali equals to 10 number. 3 grams, 10 number. Hence we increased 3 grams, 6 grams, 9 grams, 12 grams, 10th day 30 grams. That was given with Aja milk, not with cow's milk. Because Aja milk itself is having Alpambavana Vyayama, Kadudukta Ashanair Leku, Ajam Shoshajara Shwasa Rektavita Adisarjir. Aja Kshira is a medicine for Shwasa Roga. Hence we disordered the Pipali Churna in Aja Kshira and that was given for 10 days, then decreased. 30, 27, 24, 21, like that, it took 19 days for completing. After completing, next, you see the X-ray changes, this is the first one, date is also written, 18/9/2017, then it is after 3 months, you see the lung became clear, the patient is not having any dyspnea, nothing is here. He is now a promoter of Ayurveda because, actually he was able to survive with Ayurveda alone. These are the magic of Rasayana Chikitsa. Next. You see, in a study conducted in Regional Cancer Center, Trivandrum, they conducted with the help of Ayurvedic doctors, what is the prakriti of an cancer patient? 73% of patients comes under Vata Kapha Prakriti. You see, Vata Kapha Prakriti is very difficult to manage. Because, you see, Tatradya Maridan Kranti Trayastikta Kapha. There is no such a rasa which can act against Vata and Kapha. Hence, that is why all the Vata Kapha rogas are either Asatya or Satya. The first and foremost example is Shwasa Roga. Sa Yapya Stamaka. Stamaka's Shwasa is Yapya. You see, all the Vata Kapha rogas are Yapya. There is no such a rasa which can act against Vata and Kapha simultaneously. That's a problem, Then how can we treat a Vata Kapha roga? That is explained in Kasa Chikitsa. Kaphana Bandhe Pavane Guryal Kaphagaram Kuryam. First of all, you have to reduce Kapha with Pajana, Divana, all the Rutshana, using all those Aushadas. Then we can go for, when Kapha decreases, at that time that disease becomes Vata Paitika. Then Brahmanam Tuve, Shamanam, Vayu, Hopita, Nilasija. We are having medicines for that, This is the technique. Next. Srodorotha caused by the vitiation of, next. Because I know that, time is very minimum. Only 20 minutes are allotted to me. If I am exceeding the time, please don't hesitate to inform me. I shall conclude. Then, cancer versus Rasayana, disease of the aged, regime of aging, immunodeficiency, immunomodulation, Agni Mandhyam. All the patients are having chronic Agni Mandya in all the cancer cases, Hence, first of all, Esha Sarastikilsaya Edagne Parilakshanam. The core principle of Kaya Chikitsa is Edagne Parilakshanam. That is why Kaya Chikitsa. Kaya Chikitsa means Kaya Agni Chikitsa. Next. Jatara Praninam Agni Kaya Ityabhidiyate Estam Chikitsayal Sigdandam Vishamam Vapi Dehinam Ayurveda Apiyogena Savai Kaya Chikitsaka. Kaya Chikitsaka means, he is treating the Kaya Agni. That's all. You see, free radicals. This is another theory, Next. You may be knowing that, if you are, if the free radicals in the body are increasing, that is highly pathological, and antioxidants are the remedy for the free radicals. Hence, all the Rasayana drugs are having antioxidant property. Next. You see, Emblica officinae, Amala, Haritaki, Ashwagandha, all the Ayurvedic Rasayana Aushadas are having antioxidant property. Next. Degeneration means, deterioration and loss of specialized. But clinically, we deal with only two types of degeneration. Only one, knee joint or any bony degeneration. The other one is neurodegeneration. Only two diseases are there. As a degenerative diseases which a physician is seeing. Next. This is Varthakya, the Samprapti of Varthakya. Next. You see, there are 6 stages in our life. Asti, Jayate, Varthate, Viparinamate, Apachiyate, Nashyati. Before starting any kind of degeneration in the body, we have to start Rasayana Aushadha. In my opinion, we have, for a Swastha, if somebody is not having any disease, at what age I have to start Rasayana? It's a common question asked by many people, In my opinion, we have to start Rasayana at the age of 35 to 37. Then we can prevent the degeneration of the body. If the man is healthy, that is the thing. Next. Then this is the another view. Kapha Prakriti is there, then between Pitta Prakriti, Kapha Pitta Prakriti is there, then between Vata Prakriti, Pitta Vata Prakriti is there. This is the right time for administration of, again, Rasayana. Next. Because in the text, it is very vaguely told. Purve Vaisi Mathyeva, Talprayojyam Jidalpana. Purve Vaisi Mathyeva, that is the only explanation. At what age we have to start Rasayana, it is not properly explained in our text. But we found out that it is almost 35 to 37 years of age. Okay, next. Then you see Krita, the importance of Krita in preventing CNS degeneration. Only you see, only two materials medium can cross the blood-brain barrier. Good fat, that is Krita, and the other one is alcohol. Two things, alcohol medium and fat medium alone can cross blood-brain barrier. That is why in Apasmara Chikitsa, Unmada Chikitsa, in all the neurological problem, no Kashayas are explained in classical text. No Churnas are explained in classical text. Only Kritas. Why? Kritas can alone cross the blood-brain barrier and nourish the. That is why Tatra Dhi Smriti Metha Agni Kamshanam Shasya Kritam. You see, alcohol also can cross blood-brain barrier. In Ashtanga Sangraha, it is told that, Madhya Aphaso Thi Smriti Buddhi Haranam Sreshtam. You see, Dhi Thirdi Smriti Haranam Sreshtam. Alcohol. You see, two things can cross blood-brain barrier. One Krita, it nourishes brain, but alcohol destroys brain. This is a very interesting thing. Next. Then you see, Brahma Rasayana, Vatika Hridroga improves immunity, Narasimha Rasayana, oligospermia increases vigor and vitality, Tipari Rasayana, Tamakashwasa. This is the indication. These slides are kept here. If you want, you can take copy. As time is very short, I am not at all explaining everything. Next. You see, Vata Vaitiga Vata Shavanida, Chavanaprasha is the best drug of choice. As a Rasayana. Then Vata Kaphaja Vata Shavanida, Bhallataka Rasayana. For Arsas also, Shushkeshu Bhallataka Magri Muktam, Bhaishajyam, Ardreshu Varsakatak. Arsas also, Bhallataka Rasayana is good. Next. See, a vehicle with a strong axle runs its full course because of the quality of the axle, which means that, if you are maintaining our body, definitely we can travel a long distance with the body. But for avoiding a breakdown, definitely we have to take care of our body with good food, good exercise and good rasayana. That is a must. Then only we can live for a long period without any ailments. Next. Upadrava, this is told in Susara Samhita 33. Upadravastu ye jushta vyathayo yanti avaryatam rasayana dina. Delhana gives commentary. Rasayanena hyasatyo vyathirapi praya satyate rasayana dina avaryatam yanti. Which means that, even in the incurable diseases respond well to rasayana. But we have to find out the proper rasayana, and administration also should be very scientific. Next. Rasayana therapy, the possible mechanism of action. You see, all the rasayana aushadas are nutraceutical action is there, regenerative action is there, immunomodulatory action is there, antioxidant action is there, adaptogenic action is there. Almost all the rasayanas, which means that, rasayana drugs acts at the very subcellular level. Next. This is another theory. There is a PCD. PCD means programmed cell death. Our skin cells are, replaced every 2 weeks. Our skin cells are replaced every 2 weeks. Our RBCs are replaced every 120 days, which means that within 1 second, 2 million RBCs are destroyed. With this sound, 2 million RBCs are destroyed. Another 2 million are produced in our body. We are not recognizing. You see, our liver cells are replaced every 6 months. every 6 months. But you know, our brain cells, our heart cells, our kidney cells are not at all replaced. That is why they are called Mahamarmas, which is not replaced. But if all these other cells are replaced systematically, but you know, you see, the delicate controlled elimination of cells is called programmed cell death. Excessive cell death leads to AIDS, neurodegenerative disease, stroke and other problems. Undue survival is also harmful. It may produce tumor and other problems, you know. Rasayana may help to normalize the PCD, programmed cell death, by thereby preventing the above clinical condition. Next. You see, the application of genome code theory may create a disease-free universe, you know. The most important therapy of the era may be rejuvenative. Actually, even the Ayurvedic doctors are not at all exploring the Rasayana properly. That is why, you know, we are not able to cure many of the incurable diseases. If you are concentrating on, nowadays, many of them are concentrating on Shodhana Chikitsa. Panchakarma is getting, you know, universal acceptance. But our Rasayana, I don't know. It's very behind. I don't know why it is not getting the proper recognition. Next. Next. Hello? You see, the scientific use of Rasayanas will provide a graceful aging. Ramyam Parinama Vapanavati. Aging cannot be prevented, but it can be delayed. That is why Ramyam Parinamam Avapanavati. Next. This is from Charaka. Na kevalam dirghamiha ayurasrite rasayanamayo vithival nishevate gatimja devarshi nishevitam shubham prapadyate brahma tateti chakshayam. You can read the meaning. Next. I cannot present this paper without remembering him, because you know, you may be all know who is this? Dr. L. Mahadevan. I think he was having many fans from among the students, you know. He was a great speaker, good academician, a great writer, a good teacher. Many qualities are attributed to him. He was one of my favorite students. When he was doing his PG, you know, I was the guide, you know. We worked together for 3 years at that time. Even after that, you know, when he started practicing from day one, you know, we were in touch. And I think if he was alive, definitely he should have present here also for this seminar, no doubt at all, because he was the icon of Tamil Nadu also. Anyway, he left from us. That doesn't mean, you know, his books are here for the students, you know. He is living in the heart of the students. Next. Thank you.